Good afternoon, ladies and gentlemen, at the webinar Digitalization and e-health Solutions, which is titled How Digital Self-Care Can Help Improve Health Outcomes, a Case Example. My name is Erik Hans Eddes. I am Senior Advisor of Benchmarking with ICHOM, and I will be hosting this session. And this case example is of two very inspiring people from the Netherlands. Guido van den Berg, internist in the OLVG hospital in Amsterdam, and he's the chairman of the Happy App Foundation. Guido is working as an infectious disease physician in the OLVG in Amsterdam. It's the country's largest HIV center, taking care of approximately 4,000 HIV-infected patients. And in 2019, the OLVG HIV care team has won the International Value-Based Healthcare Patient Outcomes Award. He's chairman of the Happy App Foundation that enables patients to take optimum control over their health. And as a co-founder and board member of the Ushawari Foundation, he contributes to financial and medical support of 3 Zimbabwean hospitals. And also in the session is Joop Arends, who you see, he's the founder of the Happy App. And he was trained as an internist, infectious disease physician, and received his PhD in hepatitis C on a thesis entitled Immunological and Virological Changes During Treatment for Hepatitis C Infections. And he published over 150 peer-reviewed articles and supervised 8 PhDs successfully and served as principal investigator in international studies. He became associate professor. But next to this, Joop's passion for digitalization and innovation led him to found the Health Appie, Happy, in 2016. And its aim is to provide patients with knowledge, easy and trust in managing their chronic disease so they become happier and healthier. And what I think is very important and challenging, in the summer of 2020, Joop decided to become a full-time healthcare entrepreneur and is now fully dedicated to developing the Happy platform. We will see a presentation of Guido van den Berg, a video, and afterwards Joop is happy to take any questions you have. You can raise your hand and you will be live in the session to discuss with Joop. But first we will start the VT.
Ladies and gentlemen, thank you very much for allowing me to share the experience I have with how digital self-care can help improve health outcomes. My name is Guido van den Berg. I'm an internist based in Amsterdam, and I'll hold this presentation on behalf of the HIV care team at the OLVG hospital in Amsterdam, and also on behalf of Happy App and my colleague Joop Arends, who will answer the many questions that you will hopefully have after this presentation. I would like to start with our HIV care team, and I like to show this picture because you do not only see HIV doctors and nurses, but it's a multidisciplinary team. You see a psychologist, psychiatrist, medical microbiologist, a pharmacist, and a social worker. And later on, you will understand that HIV care nowadays is a model for multimorbidity management. And this is where our hospital is situated, in the beautiful city of Amsterdam, where we have several locations and where we are taking care of approximately 4,000 persons infected with HIV. And what I'm going to talk about in this presentation is how we apply the value-based healthcare principle to HIV care. And I'll explain how we did this in close collaboration with our patients. And then, because that's what the talk is about, how digital self-care, in this case, the Happy App as a case example, contributes to that. And now also we keep our patients involved in the continuing process of improvement. I'll show you something about the Happy Data Lab that allows us to improve the quality of the care that we provide, and how you can extend this principle to other disease areas as well. But first, back to the HIV care and how we applied value-based healthcare. And we asked ourselves the questions when we were searching for outcome indicators I can tell you that there isn't an international outcome indicator set yet, but the working group will start somewhere soon, and I'll be part of this working group. But we asked ourselves the questions, three main questions. We were searching for outcomes that, of course, had a high impact on patients, that are frequent, and that we could positively influence during the care process. And then you can see it's not rocket science. We came up with, we want the HIV therapy to be effective, not at the expense of any side effects. We want our patients to have a good quality of life, a good mental and physical health. We want the risk to get a heart attack or a stroke the next coming 10 years to be as low as possible. And of course, we do not want our patients to die. Now, we did so in close collaboration with our patients. So we had several patient evaluation groups, and we used the survey that our national patient organization held several years ago, called Positief Leven, freely translated Positive Life. And they were asking at that moment almost 500 members, what factors are influencing your quality of life in general? Now, what we did is we redefined our care path and encoded it into our electronic file. And at each step in that patient journey, we defined what is being expected of the different stakeholders, like doctors, nurses, the patient, him or herself, doctor's assistants, etc. So we could be able to see if we change things, so if we intervened in the care process, what effect that would have on the outcome indicators. Now, ideally, the patient is, of course, in maximum control. And there's where the Happy app came in place, an application that we developed several years ago. And it is the baby of an innovation conference that we organized with our patients and some general practitioners, HIV doctors and nurses. And what Happy does is it provides our patients with knowledge, ease and trust in dealing with their general health and their chronic disease. Happy started as a HIV appy, but now it is a health appy that is applied to other disease areas as well. Now, what is Happy's vision? And you can see here on the right-hand side, a person holding an app. But as you probably know, before you know, you have 3, 4, 5, or even more health-related apps. And we envision that with Happy, the patient has one app that centralizes knowledge and data and helps the patient to be empowered. And through that, it supports the patient-doctor interaction through remote monitoring. It makes life with a chronic disease a bit easier. And these different domains, patients have to handle their medication. They could have a Fitbit and check how their weight is doing, if they have enough steps that day. They interact with patient organizations, social platforms. There's, of course, in most circumstances, a code and with which you can see your blood results at the hospital. And there are other health data coming in. Now, what we did with our patients, Happy has advisory panels on the different disease areas, so also for HIV. And at this moment, the National Patient Organization provides 2 weekly newsletters. It has been doing that for over 2 years now, with over 1,200 participants. And it is very good for the patient organization. They explain us ourselves as well. They reach another public, so quite some persons who didn't become a member, an active member of the patient organization, are now being reached with very valuable information, like how does HIV relate to COVID-19? How do HIV patients respond to COVID-19 vaccines? There are long-acting injectables coming now. What are the expected advantages from a patient perspective and possible disadvantages compared to oral treatment? Now, patients really appreciate this 2 weekly newsletter. And all new features that we develop in this digital self-care app are being developed with close involvement of the patients in the advisory panels and the patient organization. Now, back to the outcome indicators, therapy effectiveness, and I'll get to the next slide immediately. Since we know how to suppress the HIV virus, since 1996, there has been a dramatic improvement in the life expectancy of our patients. And it's all about suppressing the virus, which you can see here. The patient can see easily on the smartphone how the viral load dynamics are over time. Now, of course, you don't want this therapy just to be effective. You don't want it to be effective at the expense of many side effects. And we do not only measure parameters like liver and kidney function, but we also ask our patients, how would you rate your medication and to what extent do you experience side effects? And we ask that with a text, but you also see a kind of visual analog scale where 10 means many side effects in red, and 1 would mean very little side effects, green. And when health outcomes are being reached and they are green and we are happy, and if health outcomes are not being met yet, then the smiley is orange or red. And also that therapy tolerance that we try to quantify can be followed over time through a graph. Now, how about health-related quality of life? There's, of course, many factors that influence a person's quality of life, and we want to assess domains in physical and in mental health. And mental health problems are prevalent in our population. What you see here is results from our clinic, from the OLVG population. And for the screening, we use the Hospital Anxiety Depression Scale, HADS. And when you look at the total HADS on the right-hand side, and if you take off a score of 15 as a cutoff, you can see that in our population, 25% of the patients have an elevated HADS score. And we refer these patients to the psychiatry department, and in 92% of cases, a psychiatric diagnosis was there. And as the name implies, you would think, maybe think only anxiety disorders and depressions, but there could be other psychiatric diagnoses as well, like personality disorders, post-traumatic stress, or addictions. Now, we assess this mental health through PROMs. HADS is an example of such a PROM, patient-reported outcome measures. And we validated that in our population and published it in Quality of Life Research 2 years ago. And what we currently assess is general health, and you can see it here below. We use the SF12. We check for stigma, the potential sexual difficulties, sleep difficulties. I spoke about HADS. We check for social support, self-esteem, and medication tolerance. And we developed an infographic in collaboration with pharma, so that patients and care providers understand why PROMs can really improve patient-doctor relationships, but also health outcomes. Now, these PROMs, because how does HAPPY facilitate this? Patients can fill in PROMs through paper forms in tablets. They can have an email sent via the electronic health record, but it's also possible to fill in the PROMs in the app. And the app makes it more fun to fill in the PROMs, because our patients tell me that it can be quite boring to fill in the questions. But in this case, a chatbot, a friendly face, a friendly little figure tells you, reminds you that you have an appointment next week, and asks you, proposes you to fill in the questions. And you do not only fill in the questionnaire, but the chatbot is asking you a question and you answer. It asks a question again and you answer again. So you have a conversation, which makes it quite more fun to fill in the questions. Patients can stop at any time and finish the chat later. And there are reminders installed for increased adherence. So the PROMs are finished and patients maximally prepare for the consultation. Now, as you probably know, being interested in value-based healthcare, of course, it's not enough just to ask about patient-reported outcomes. Patients fill it in the first time because you ask them to do it, but PROMs should be actionable. So if there's an unfavorable outcome, it's good to have an action and intervention for that. And going back to the app, if there are signs of mild anxiety or depression, people can be directed to a self-help module. And that's an online mental health self-help module from the psychology faculty in Leiden, somewhere else in the country. And that's a proven, validated intervention that has been published in the Lancet HIV. Now, when people experience loneliness, and that's a good example of something that we really developed extensively with the patient organization, when patients feel lonely, they can use a kind of gaming feature in the app, and patients fill in some questions about what do you prefer, being in the city or being in a forest? And do you prefer more drinking beer, drinking wine, or non-alcoholic beverages? And then when you have a certain profile, a chatbot can start talking to you and show you that somebody else has at least 70% similar answers, so has a match. And then the chatbot proposes to get to know this person. And we know it has been proven in elderly homes that people who are perhaps too tired, too insecure, too depressed to open the front door and to get to know a person or to get into conversation with somebody, that this game helps people to take the first step and get to know other persons. So it really helps fighting loneliness. Cardiovascular risk. Of course, there are many possibilities to measure your weight, and there are Fitbits and there are websites, portals where you get all kinds of information that influences the cardiovascular risk. Of course, we want to combine that into one app, and in the Happy app, there are the risk factors that can predict, and in this case, it's somewhere below, let's say, 23% chance that people get a cardiovascular event in the next coming 10 years. But it also shows, people can play with it, what happens if people, for example, quit smoking. And in this example, the cardiovascular risk would drop from 24 to 9%. And simply showing this is a first intervention, and it makes some people wonder, how can I stop smoking, and can I please get help for this? We also build in other features to promote healthy living, and there's a dashboard with important feature for a healthy lifestyle, like the nutrition and the connection with a health kit for exercise import. Happy helps patients to set a treatment goal, and it formulates your own goal to optimize therapy. And again, a sympathetic dialogue is helped a patient, what would you like to accomplish and what would you like to discuss next week when you're meeting your care professional. The treatment goal is displayed on the dashboard on the smartphone. But Happy also has a portal, so it's not just a dashboard on a smartphone for the patient to have a maximum overview, but there's a portal for the healthcare provider as well. And it helps getting an easy overview, an easy interpretation of longitudinal data. And what you see here is somebody who's experiencing a skin problem. And what you can see rapidly is level of itchiness, pain. Does it influence somebody's mental condition, and what does the skin actually look like? So immediate intervention by a healthcare professional is possible with this clear overview. Happy has a data lab where patients can provide their data anonymously, of course only with informed consent. And our patients have the right to be forgotten. So if they decide 1 or 2 or 3 years later that they don't want to be part of this data lab anymore, all the data can be erased. But we use this to improve the quality of care. And as we speak currently, approximately 900 persons with HIV and 200 persons with a chronic skin condition have given consent. And especially, of course, in trials, there are the classic parameters that are being followed up. Here you have real life data from patients who cannot be excluded from trials, and where especially quality of life parameters like sleep, mental health, concentration, etc. are included as well. It is meant for research to be able to improve the quality of care. Now, I gave you several examples how patients can see how they are doing over time. And what patients, of course, will help a lot if patients can compare themselves to other patients like me, who have the same age, are about in the same weight percentage, have the same cardiovascular risk factors, and that helps them to see where they stand out, and also how they can positively influence the health outcome and where they stand then compared to other patients. From the one part, it could help promote competition, and in that sense promote health promoting behavior. On the other hand, it can also help patients to see it's not so strange that every now and then, for example, you feel tired or you feel down, because it's part of who you are. It's part of your disease, for example. Happy is disease specific, but this general principle with measuring and defining health outcomes with the care provider and the patient, and providing people with knowledge and ease and comfort in how they deal with their disease and health can be applied to other diseases as well. And currently, Happy is not only HIV Happy, it's a health Happy. It's now also available for people with chronic skin conditions like eczema and psoriasis, for people with certain hematological disorders like chronic lymphatic leukemia, essential thrombocytosis, polycythemia vera, so the MPN, and for fatty liver disease. And other disease areas are under investigation, for example, COPD and prostate cancer. This is the Happy team. This is me, my colleague Joop Arends, who is happy to take any questions from you. We have Rob Peters, who's a co-founder as well, and is about business, tech, and marketing. And Dan is a dedicated pharmacist. For every disease area, we have a dedicated champion, a doctor in the field that worked with the patient organizations. And you can see we have many partners. And that's not just patients, it's launching hospitals, launching partners, it's e-sites that's developing the app, it's health insurance, and it's pharma as well. Things we are proud of: in 2019, we won a national award, the Ventura Impact in Healthcare Award. In 2020, we won a national digital award, a Dutch Interactive Award. And we are proud that in this year, the International Value-Based Healthcare Collaboration Award was awarded to us. As we speak, we have over 5,000 downloads. About 1,100 patients are now sharing their data anonymously with the data lab that I showed you. And as I showed you, 1,200 happy users are now receiving a 2-weekly newsletter from the HIV patient organization, and the skin organization will start within a few weeks following this example. Now, it's freely available for patients. The app and the portal is freely available for healthcare providers. At this moment, it's available in English, German, and Dutch, but we are extending that as well. And well, I hope that you got a clear idea about how Happy is helping to put the value-based healthcare principle into practice, and that probably this principle can be applied to the field where you are working yourself. And thank you very much for all the attention, and please ask questions to my colleague Joop.
Joop, I think it was a great presentation. It's a great initiative, and I think it's so important that patients are encouraged in their self-care and that they are in control. And this is a so good example how that's being achieved. I do have some questions myself, but the audience is first, and please raise your hands or use the app if you have any questions, and Joop is happy to answer them.
In the meantime, I can shortly apologize because Guido would happily have been here himself. Of course, he is the value-based health expert of the two of us. But he had another pressing meeting, so that's why we divided the two roles. He did the presentation and I did do the Q&A, so his apologies.
I'll do have a few questions. You had this very nice slide where the Happy app is the center and gives all the information to the patient from the hospital. Which means the Happy app has to be connected with the EMR. What are the challenges you have to overcome with that? Because that's always a bit of a difficulty.
Yes, that's a great difficulty actually. At least in the Netherlands, there are two major companies, I think, for at least for the hospitals, and there are a couple of more for the general practitioners. And interconnectivity, I think, in a lot of countries is still quite a challenge. There are different solutions per country, and also in the Netherlands, we are trying to have one sort of interface connectivity, perhaps for every. You have to go to every hospital to have a different connectivity. That's why, in the meantime, because that's still not solved, and we are waiting either for the bigger companies to move or the government to show a clear vision. So that's why we decided to install a portal. So at least the doctor or the care provider in the hospital can log on from every device on the portal himself, and then with one button copy the patient data into, for example, the hospital dossier. In the end, of course, our vision will be to have a easy connectivity, but then also our main starting and focus point is the patient. And if you reason from a patient perspective, the hospital is only a couple of hours per year that he or she has a connection with. And for a stable HIV patient, the contact between a stable HIV patient and a doctor, Guido or me, would be only a couple of hours per year. From the hospital, we think we are very important in the life of a patient. But if you reverse it in the patient's life, the hospital is only, when they are stable, a very small part. So we are basically more looking from that perspective and seeing, so that would be an addition to make life easier. But we are focusing also on a lot of other areas which would really could help the patient, because that has a bigger influence on a patient's daily life than the hospital connectivity. So it's a little bit of both. There's one question I can probably answer: what is the future and expansion, or with regard to expansion or development plans? And I think that's an excellent but also difficult question, because that comes back to the dilemma also Guido showed in the presentation. On the one hand, we think this could be also the happy app could also be a value or contribution to other disease areas. So we could focus on other diseases as well. That would be one way to go forward, and the other way would be just to really further develop and dive into the needs and the value for the specific disease areas we have. And for example, not only look at the Netherlands, but also look at more international, for example, Europe, or even further expansion. So we are constantly debating between Guido and me and the rest, what is the most value, where can we have the most value? And the examples Guido showed with the depression, self-esteem, stigma, actionability of the app, we think that's really the way forward. So I think for the short term, we are more focusing on really contributing actionable outcomes and let patients really execute on the things in the app. So really to be a companion for patients in a daily life within the 4 disease areas. And then later on, I think we would focus on other diseases as well. So I think in the short term, we would focus further on extending the 4 diseases we have at the moment.
Yeah. And I also was intrigued by the usage of the app in the prompts. Because what you pointed out is at the first time patients are invited to fill in the prompts, but I didn't hear Guido say it in that way. But do you see that patients automatically fill in the prompts when they start using the app? Because I think that's also a great advantage.
Yeah, so we have a repeat frequency of 1.4, I think 1.5. So after 3 years, at least it's not every year, but at least there's a repeat frequency in repeating the questionnaires in the app. Depending on which app you're looking at, because the hematology and the liver disease app have a trigger, an automatic trigger after half a year. There's an automatic trigger. You should repeat the questionnaire. In the HIV app, we didn't install it because the frequency depends. Guido showed him his care path in the OVG hospital. In my prior hospital, we had a different frequency schedule. So we didn't do the triggering yet in the HIV app, but also in the HIV app, we see that patients return and use the questionnaires, the prompts from themselves. But we would like to install sort of triggering based on complaints. So what we are now doing with the depression self-help module Guido showed, that we are asking is the depression resolved spontaneously? Did you get treatment? So we want to sort of more individualize based on the prior answers. So also because the chat remembers which answers you gave. So if you gave in an earlier stage, you gave a certain answer, for example, being you were tired, then you don't start the whole tired prompts again, but you just first have that question, are you still being tired? Is that a problem for you? Okay, do you want to do the questionnaire again, or has it been resolved, you don't want to do it again? So in that way, you don't have the standard set anymore of how many questions, but then personalize it and tailor it based on the prior history. That's the way we want to move forward.
Yeah, I think that's very important. They don't have to fill in the whole list. And how about the response rates? Is it? Do you have a clue of any percentage or
response rate? You mean numbers of patients using it?
If patients start filling in the prompts, do they come back, or do you lose patients along the way?
That's a difficult question because the funding of the app is mostly in 90% paid for by grants and sponsorships, mostly from pharmaceutical industry, and they don't allow, that's Dutch law, to spend it on anything other than real software development. So we put all our money into software development, and this is, well, in a way software development, but on a different level. So the whole analytics and backstory things. So we didn't have any money for that, so we don't really know at the moment.
Okay.
But that's a good question.
Yeah. Because that was my other question about the funding, because I think it's so essential that you have the self-care and that the patient is in control. And I think initiatives like yours should be funded on a structural base in healthcare. And are you in discussion with payers to have this functionality structurally paid for, or and that's what I hear you saying, because at this moment you are dependent on grants.
Yeah, so that's a good discussion, and we had a first round of funding from a healthcare company, and then after 2 years, when we were a couple of stages further with the development, we came back to them and saying, well, now we can show you that we improve the quality of care for HIV patients. And then they said, well, what does it cost, and where's the reduction for us in money-wise? Well, of course, for HIV, the biggest budget is 70% is the medication. So it's really difficult to have a cost saving on that side. But that's always the difficulty. If you're really focusing on quality and easiness, that's not really easily translated into cost reduction. So then what we did is we asked one of our patient panels to list. We drew up a list of 15 functionalities we thought we would have benefit for patients. We asked them to list them from 1 to 15, being 1 the most valuable, and all with majorly on top was medication delivery through the app. So that made us realize that would be a big value for patients, where it would be a business model for us. So because patients come back to us for prompts, the contact with the patient association, also they come back to the app for medication delivery. We are being an online pharmacy delivery, basically. And for us, that's a business model. We compete with the pharmacy around the corner. But for the patients, it's an added value because it was their request. So that's how we earn a little bit money now, and we also get a loan from the bank, an innovation loan from the bank. So that's how we are funded at the moment.
Yeah. And are you still in discussion with the payers and the insurance companies in the Netherlands for a contribution?
Not at the moment, because we are now focusing on other things. For example, optimizing the medication delivery chain. But for next year, we do, and mostly for skin, because I think our business case from a business side, that's easier, because exacerbation reduction is showing more remote care, delivering a lower workload for dermatologists. That case is stronger for dermatology, I think. So we probably will go to the health insurer with the dermatology first to see if that will be a valuable case.
Yeah. Okay. And let's see if there are any questions, because otherwise I'm the only one posing questions. I do have a whole list.
Everybody is intensively listening, probably.
Yeah. Are there any questions from the audience? Please raise your hands or use the chat function.
Laura is asking if the information is connected to the medical record. If the app is connected to the medical record, I think, of the patients. And the answer is only slightly with the OVG in Amsterdam. So technically it's possible, but it really depends on the company providing the electronic health record, actually, to open up their files to connect with outside apps. And at least from the Netherlands, I know that those experiences are very limited, and those electronic health companies are, well, hazardous and not very open to outside app connectivity. I'm not sure if that's in other countries. What we are exploring already for some time, but due to COVID, we got a little bit of a delay, is that we are connecting with CGM in Germany. They have their third-party cloud platform where they connect apps on the outside with their internal medical records software platforms. And that connectivity is nearly there. So in Germany, with clinics who also use the CGM system, then there would be a exchange of data and also a connectivity to the patient health records.
Yeah. There is another question, Joop. Are patients also asking for live connection or events through the app?
No, not at the moment. I'm not sure what is meant with live connection, if that's more like a chat and connectivity among each other, or that it's live connection with the healthcare provider. In the later instance, we know from healthcare providers that they are very hesitant because they also have other ways of communication with patients, and they are always very busy. So they are always afraid that they get a tsunami of new notifications or messages. So I know that most healthcare providers are hesitant to have a next way of connectivity with patients. In the end, basically organized by those here. Yeah, so I think in the end depends a little bit on the system they use. So most electronic health record systems in the Netherlands also have a way of communication with patients. So that's an email, of course, although that is discouraged, is also a way of communicating, and they want patients mostly to just call, old-fashionedly call. I think a way of 24/7 interaction with your healthcare provider will be the way forward. If I look at how my kids interact with each other, it's always 24/7, not only in the hours the company or the other person wants them to interact with. So I would say a way of 24/7 interaction would be possible. Our system could be that, because we also have a chatbot. So you could first have a sort of chat and then delay questions to a healthcare provider. But I think that's depending on the future.
Yeah. We got a message that we only have 5 minutes left. I do have an urgent question, Joop. We have in the Netherlands also the HIV monitor, an organization also gathering information paid for by the government, by the way. Do you see any collaboration? Because there probably are some fields of overlap, and I think these are both great initiatives. Do you collaborate? Do you seek each other, or and how do you see that in the future?
Yeah, that's an excellent question or comment, and I do foresee a collaboration in the future. There was a new director this year appointed. The old director retired, and there's a new director. So I think that opens up opportunities, because a lot of things sometimes are delayed by diplomacy issues and legacies of certain people. There is overlap, although the SIM, the Stichting HIV Monitoring, the HIV Foundation, Monitoring Foundation, really focuses on hospitals and just gathers what is in the hospital gathered on data, whereas we are really collecting what the patient is putting in. So I think there's a little overlap, but then also a lot of contribution to each other, which makes the data in the end stronger. So I would really like to collaborate in the future, and I see a lot of possibilities. But the discussion is not yet started, I must admit.
Okay. Hey, and what is your dream, Joop? Where would you like to be in 5 years?
My dream is that patients, that there's not a black and white, so that there's a sort of blended care, that patients are in their private of their home, just monitoring themselves. When the things are in green, fine, they don't have to come to the hospital. In the hospital, there's a nurse or somebody looking at the monitor, checking who is going into red, and only contacting the patients who are going into red smileys. They come back to the hospital. The green ones just stay at home, and that leaves room in the hospital for patients who are not able or don't want to go digital, and they just want regular care at hospital. So I don't want a total digital society. I want a digital society or care for the ones who want it and can do it, so that leaves room in the hospital for doctors caring for patients who really want care in the hospital. That's what I want in 5 years.
Great. We are nearly going towards the end. I'm looking towards the audience. If there is a last question.
If questions later arise, they can also always reach me at Joop, my name, JOOP @happyapp.nl. So don't hesitate to send me an email if you have any further questions regarding the Happy App.
Yeah. And if you don't manage to reach Joop, please reach out to us, to iChom, and we will connect you to Joop, to the people behind Happy App. I would like to end this session not without thanking you, Joop and Guido, very much. I think this really is a great initiative.
Thank you very much.
Yeah, I think really one of the missing links in healthcare. It's about improvement. It's about measuring. But it's also about connecting with the patient. And I think initiatives like yours are the instruments in connecting the patients. And I really want to congratulate you with this. And I really embrace your dream and
digital.
And I hope the payers will put some extra money, that you're not dependent on grants only. Thank you very much. Thank you, the audience, for being here with us. And if I am right, the link in the chat will appear for changing to the next sessions, which will start at 16:20. Thank you very much, and I hope you enjoy the rest of our conference. And once again, Joop, thank you very much. And also for...
Thank you very much, everybody.
Okay, bye-bye.
Bye-bye.